If you have nasal congestion or rhinitis, they say side effects are inevitable during surgery.
There's a very good reason for that.
Hello, I'm Jong Taek Lim, the director of Rhinoplasty Surgery, Realizing Beauty. Today, when considering nose surgery, side effects are something you cannot overlook. Today, let's take some time to thoroughly look into these side effects.
The most common and worrying case is inflammation. The second is contracture, and the third or fourth issues usually shift to aesthetic problems. If your bridge turns red, swells, discharges pus, or smells strange after nose surgery, do not delay. Go to your clinic immediately. It's always best to take action as soon as possible. In most cases, it's impossible to simply say a cause B for side effects like inflammation or contracture. Ultimately, it's a bacterial infection at the surgical site that damages normal tissue, and this could be due to a sterilization issue right from the start. Something could have gone wrong during the surgery, or an infection could occur afterward due to a weakened immune system or exposure to an unclean environment. Therefore, it is often difficult to pinpoint a single cause, and how you handle the problem when it arises is what matters most. All doctors tell you not to drink or smoke after surgery. There is a reason for that. Our bodies are constantly undergoing immune responses and various activities to heal the wound, and alcohol or nicotine can have a very negative effect on that healing process. So I recommend abstaining from alcohol and smoking until things have stabilized as much as possible. There are still various cases for revision surgery, but if the surgery involves silicone, it must be removed if inflammation occurs. You should remove it quickly, and once the inflammation has completely subsided, you can have revision surgery if you wish. If the process was too difficult, they might choose not to have revision surgery. As in cases of capsular contracture, persistent inflammation causes the capsule to thicken and shrink, making the nose look upturned and feel hot. In such cases, revision surgery is the only way to improve the condition. If you release the shrunken capsule or tissue as much as possible, it often improves significantly. So if you have capsular contracture, don't think you have to live with it forever. There is a good chance it can get better, so I recommend you come in for a consultation. The rest is ultimately about appearance. If the tip of the nose has drooped a little or the silicone appears slightly bent and you want to correct the appearance, then consider it as a case requiring revision surgery. For all revision surgeries, textbooks say you need at least 6 months for the existing scar tissue to soften. However, in cases of inflammation, you must remove it immediately, regardless of the timing. It is not a matter of waiting 6 months, it must be done right away. When you decide to have revision surgery after removal, that requires at least 6 months. Waiting longer is fine, as it allows the tissue to soften more.
Doctors are read online that if you have nasal congestion or rhinitis, you'll definitely have side effects from surgery. Is that a fact?
There are many causes of stuffy nose and rhinitis. However, in the case of allergic rhinitis, you should think that it won't get better or worse because of surgery. The problem now is structural, but if there's an issue like a deviated septum or nasal valve problem, surgery might actually improve these conditions. However, if you proceed with surgery without considering that it could get worse, I recommend you check if such structural issues exist and if they can be resolved. Today we looked at potential side effects of nose surgery and revision surgery. While the surgery itself is important, it is also crucial to manage it safely to maintain the results. If you have any concerns, I recommend consulting with a professional to resolve them. If you have any questions, please leave a comment and I will do my best to answer them. Please like and subscribe. Thank you.